Good afternoon. My name is Tracy Carter, and I'm a nurse taking care of David Wilson. David Wilson is a 35-year-old male who came to us after a heroin overdose. He is getting a gastrostomy tube that he will have to continue to have the rest of his life. He is currently being cared for by his mother and his father, but mom is the primary caregiver. So I'm going to go in and I'm going to address mom and educate her. So good morning, Mr. and Mrs. Wilson and David. Mrs. Wilson, I hear you're the primary caregiver for David. So today I want to teach you how to check placement and pull residual. That's the same thing as checking placement, making sure that's in the stomach and not in their lungs. And we are going to check to make sure David understands and we're going to verify the orders, and then we're going to give you a little bit of education. So first thing, Dr. Potter has ordered. He has ordered that we assess David every 4 hours. So we just want to come in, we want to look at him, we want to make sure that he doesn't have any shortness of breath, any nausea or vomiting, any complaints of stomach pain, several episodes of diarrhea, or that he is having funny sounds in his lungs. And then notify the doctor if you're having any of those. So the first order doctor ordered was to assess every 4 hours. Check that placement, check that residual. The residual and placement is going to be every 4 hours as well. And then we're going to give him 400 milliliters of feeding and a 30 milliliter bolus of flush, which can only be water, nothing else. If we pull over 200 milliliters back on the residual, we need to put it back in, notify the doctor, and then every hour reevaluate him. So the first thing we're going to do is clean our hands. Once we get our hands clean, we're going to put on our gloves. And we're going to check placement. So how we check placement is we're going to take our syringe and our tubing, and we're going to instill about 30 cc's of air in. And then once we have instilled the air, we're going to pull the residual back out. Again, anything over 200, you're going to instill it back in, notify the doctor. 100, you're just going to hold the feeding and then reassess every hour. So once we put that back in, we're going to clamp the tubing. From there, you're going to take out the plunger. Once you take out the plunger, you're going to put the syringe back in. And from there, after we've shaken up the feeding and it's opened, we're going to pour in our feeding. We're going to allow that feeding to drain. You don't want it to get empty because that can actually cause gas. We're going to pour some more feeding in. Once he's had that 400 milliliters of feeding, we're going to pour in our 30 cc's of flush. Once that's done, we're going to clamp this and put the top back on this. Some side notes, Mrs. Wilson, that we're going to talk about is that you need to make sure that if he is having a feeding done, that the head of his bed needs to be at least 30 degrees. It needs to stay that way for about an hour afterwards because he can actually aspirate it into his lungs. That means it just comes back up from the stomach and goes into the actual lungs. So we don't want that. So we're going to make him set up for at least an hour. We want to make sure that when we pull the feeding, we have it connected with the tubing. We want to pull it up, but about 18 inches, no further, so it can drain by gravity. We never want to force this to go in. Forcing it to go in can cause abdominal cramps. It can cause diarrhea, so on and so forth. We also want to make sure we're using our gloves in good hygiene. Make sure that he's not having any pain. If he is, please stop the feeding, call the doctor. When you flush, again, it can only be water. You're also going to need to weigh David every week so that you can make sure that he's getting his proper nutrients. Those who have tube feedings have frequent diarrhea. We need to make sure that his skin integrity on his bottom doesn't break down. If he's having multiple stools, we need to call the doctor. Also, Dr. Potter will probably want labs every week. Somebody who's on a formula feeding, their glucose levels do go up, so therefore they need to make sure they have their labs checked. We need to make sure they're getting all the nutrients that they need. If you have any questions or concerns, please feel free to call us. Thank you.